Now, democracynow.org, the War and Peace Report. I'm Amy Goodman. Is depression manufactured? 2 decades after the introduction of antidepressants, it's become commonplace to assume that our sadness can be explained in terms of a disease called depression. The National Institute of Mental Health estimates more than 14 million Americans suffer from major depression every year, and more than 3 million suffer from minor depression. Some 30 million Americans take antidepressants at a cost of over $10 billion a year. Well, my next guest argues, while depression can be debilitating, it's also been largely manufactured by doctors and drug companies as a medical condition with a biological cause that can be treated with prescription medication. Psychotherapist and writer Gary Greenberg participated in a clinical trial for antidepressant medication and found that more often than not, the drugs failed to outperform placebos. His latest book is a scientific, medical, historical, and cultural exploration of the antidepressant revolution here in the United States. It's called Manufacturing Depression, The Secret History of a Modern Disease. Welcome to Democracy Now!
It's good to be here.
Tell us about the trial you went through.
I enrolled in a trial at Mass General Hospital, intending actually to enroll in a trial for minor depression. But the tests that I took showed that I had major depression. And the trial was a trial of fish oil versus placebo, which meant that I was taking omega-3 fatty acids or placebo. I didn't know which.
And what happened?
What happened was that I returned to Mass General every other week for 2 months, and I was given the same battery of tests over and over again, and as the time went on, I appeared to be getting better on the tests that were being used to measure my depression. At the end of the trial, I asked if I could be told if I was on the placebo or the drug, and they told me no, but since it was the next to the last day of the trial, I still had some pills left. I sent them off to a lab, and it turned out I was on the placebo.
What did you think?
I thought that was really interesting. And I thought that it was more interesting that the doctors really assumed that I was on the drug. The way I know that is because after the trial was over, they offered me what's called an open label trial, where I would get what I knew to be, in this case, fish oil, which is standard for clinical trials. If they think the subject was on the drug, they offer them the drug after the trial is over, even if they have no way of knowing.
So talk about your overall thesis in this book, Manufacturing Depression, 2 decades after. 2 decades after exactly what?
Well, it's 2 decades after Prozac was introduced, which saw an explosion of 2 things. One of them is sales of antidepressants in the Prozac generation, and the other is the rates of diagnosis of depression. And in the book, what I'm trying to do is to show how these 2 things go together, and how, in many respects, the drugs came first, and how this was something that has grown historically for at least 150 years. We've been heading in this direction. And basically what the book is about is why it even makes sense at this point for people who are unhappy to even think about the possibility that they have a mental illness. And in the book, I'm mostly interested to say that our concern probably shouldn't be so much with the drugs themselves as the meaning that we have for why we're taking the drugs, which I believe shapes our response to the drugs. And that what really we should be paying attention to is how easily people are diagnosed with mental illnesses, as opposed to given other explanations or opportunities for themselves to explain why they might be suffering.
Go on with that.
Where do you want me to go?
No, on that issue of how people get diagnosed and when drugs are prescribed for them.
Well, people get diagnosed largely by their family doctors, and sometimes only implicitly. In other words, you go to your doctor and you have some complaints about sleeplessness or nervousness or unhappiness or demoralization, and the doctor will give you a prescription often for Prozac after asking some intelligent questions or some other antidepressant besides Prozac. And he may not say, you know, you are depressed. He may just give you the drug, but you've seen enough on TV, in ads, and heard enough to know what the deal is. You don't need a weatherman to know which way that wind blows. Or he does tell you that you're depressed and explains to you that it's a biochemical imbalance. And so when you take the drug, if you feel better, then indeed that confirms that you were sick in the first place. And I'm not sure that it's necessary to do that in order to get whatever benefits there are of these drugs.
Today we're seeing major recession, jobs, unemployment. People can get very depressed. What happens, what do you think should happen? How should this be dealt with?
Well, I don't know that we're that far off. I mean, there's no reason people shouldn't confide in their doctors or their therapists about how unhappy they are. But to be told that you have a biochemical illness is automatically to distract your attention from those kinds of conditions that you just mentioned. In fact, I think that the American Psychiatric Association is going to move even farther away from any kind of consideration of causes that come from the outside. In their next edition of the DSM, they're eliminating, at least they're planning. The DSM is the Diagnostic and Statistical Manual of Diagnosis. It lists the diagnoses of official mental illnesses. Right now, if you're simply suffering from bereavement, somebody dies, you can't be diagnosed as depressed unless your unhappiness lasts for more than 2 months. In the next edition, they may remove even that as an exception to the diagnosis of depression. And so
remove what?
The bereavement exception. So in other words, if you're bereaved now, you meet all the criteria for depression, but you can't be diagnosed because you were bereaved. Research shows that bereavement isn't any different from other psychosocial stressors like unemployment, like divorce. So rather than grapple with that, the American Psychiatric Association seems to be moving in the direction of simply eliminating the exception. So what I'm getting at is that it's very difficult in the context of a doctor's visit, because doctors aren't trained to do this, to talk with people about how their world might be at least part of why they're demoralized.
And then take that a step further.
Well, if people then are encouraged to think of external circumstances, then they may be more empowered to take action. They may be more ready to consider the possibility that what they need to do is engage somewhere in the politics of their world. They may be ready to tell their own story about what depression is about rather than the biomedical story.
We're talking to Gary Greenberg, who has written the book Manufacturing Depression, The Secret History of a Modern Disease. Talk about how the definition has changed over the decades and how we deal with it in this country.
The definition of depression has been changing since it was first introduced as a medical concept, which was about a little more than 100 years ago. But the most radical changes have occurred after 1973, when the American Psychiatric Association had suffered a series of embarrassments, including particularly the discovery suddenly that homosexuality really wasn't a disease. And they were forced to grapple with the fact that they not only were there questions about whether their diseases really were diseases, but doctors couldn't agree on the same patient what disease that patient had. And so they went to a system of diagnosis that's purely a checklist. If you meet the criteria, then regardless of your circumstances, you have the disease, and that's how depression works. And so over time, what's happened is that the diagnosis has gotten increasingly detached from any sense of where it might come from, either within the psyche, as Freud would talk about, or from external circumstances, as more politically minded psychologists would talk about. And that, of course, goes hand in hand with the idea that it's a biochemical illness, because if it's not being caused by your external circumstances and it's not being caused by some, childhood trauma, then what's left? It must be being caused by something inside your brain, and it's become a brain disease.
What role do pharmaceutical companies play in
Well, pharmaceutical companies have been very eager to jump on that bandwagon. In fact, in many respects, they've originated that idea, or at least spread it through the culture like a virus. Since about 1960, the drug industry has been actively engaged in trying to help first doctors and now patients believe that demoralization is really a mental illness. They've done it through very clever marketing. For instance, they distributed 50,000 copies of a book called Recognizing the Depressed Patient to prominent doctors back in the early 1960s, in which the biochemical argument was made for the first time in the almost entire absence of any findings that supported it. It was like a myth that was being given to the doctors to pass along to their patients, like viral marketing. Now with TV direct-to-consumer ads, every time there's an advertisement for Prozac, it's also an advertisement for the idea that